Hi, I'm Dr. Julia Zuercher at the Animal Hospital of Statesville, and today we're talking about reproductive services. The Animal Hospital of Statesville is now offering reproductive services to help responsible breeders produce healthy puppies from healthy parents. These services are new and something we're excited to offer since not many clinics have reproductive medicine. In order to produce healthy puppies, we recommend health testing based on the breed. So each breed has different requirements or things set by the parent clubs to help determine diseases common in that breed and how we can better breed by producing complementary pairs that may, carry a disease or not carry a disease to help improve the breed and prevent those diseases from popping up in the puppies. Each breed has different requirements that you can find online at the Breed Club of America, for instance, the Golden Retriever Club of America or the German Shorthair Pointer Club of America, and the Orthopedic Foundation for Animals, or the OFA, also has a breed database of all the diseases that they recommend testing for in their dogs. There are numerous tests we can do here to help our responsible breeders, including OFA hips, elbows, congenital cardiac, patellas, dentition, and PennHIP is one that we also are certified to be able to do here. Once we have our health testing, we can create combinations to produce healthy lineages. We do have a minimum health requirement here for our breeding animals because, again, at the end of the day, we want healthy puppies, and the best chance of having healthy puppies is having healthy parents. We have 5 requirements that are pretty basic just to help ensure that our breeding animals are cared for before going into pregnancy. So we do require an up-to-date rabies vaccine, which is the law, and that the animal's been seen by a veterinarian within the past year. We also require a distemper parvo vaccine that's up to date, or pulling titers to make sure that the puppies will have appropriate immunity when they're born, as well as a heartworm test. So I'll pause on that one. Heartworms are a disease that live in the heart and can stress the heart, and pregnancy also stresses the heart. So this is an easy screening tool to make sure that mom is in the best shape possible to have a successful, healthy pregnancy. Additionally, the heartworm test also tests for some common tick-borne diseases, and in humans we know that some of these tick-borne diseases can cause infertility, so we believe that they can also cause infertility in dogs. So again, by screening for them, we can make sure that mom has the best chance of getting pregnant and carrying the pregnancy to term and having a healthy pregnancy. The last thing we require is a brucellosis test. The brucellosis is a bacteria that's found in the environment. And so any dog is, in theory, able to be exposed, but it's also sexually transmitted. So our breeding animals have a higher likelihood of having this disease. Brucellosis can cause infertility and abortion in dogs, which, again, is something we want to screen for to make sure that mom has the best chance of getting pregnant. But it is also something that can cause infertility and abortions in humans. So since there are a lot of people involved with breeding, we want to make sure that everyone is safe and that we're taking care of everyone involved. So once we have those minimum requirements, we do encourage health testing, again, just to produce healthy puppies. Then there are several different things we can do to help get a female pregnant. We have various means of insemination, so we can do natural or live cover and help with that if needed. Vaginal inseminations, which you can use fresh or shipped semen directly into the vagina. And then transcervical is something that we also offer here. So we use an endoscope to put the semen directly into the uterus, which gets it closer to the eggs and in theory can have a higher likelihood of getting the female pregnant. This is essential for frozen semen because they don't live long enough to be able to, they need the extra assistance to get where they're going, but we can use it for any type of semen. We do not freeze on site here at this time, but we can handle frozen semen and use that for our inseminations. We do require progesterone timing for our inseminations because otherwise we don't know when the best time to breed is. So I'm sure we'll talk about progesterone timing more another day, but basically we can track the female's hormonal cycle to determine when she ovulates and come up with a custom plan of when she is most likely to be fertile, and based on the type of semen and how many breedings we're doing, we can know when we need to do the insemination. We use the send-out test here because it has been shown to be significantly more accurate than the in-house test, but we're very used to having that 24-hour delay, and it does not affect our pregnancy rates. So once we have all of that worked out, hopefully she'll get pregnant, and then we can also monitor the pregnancy. So for low-risk pregnancies, that's ultrasounding to diagnose the pregnancy and determine if we need to, deworm or change anything about mom's care to promote a healthy pregnancy. But some of our females are a little more high risk with their pregnancy, so we can also monitor those pregnancies to make sure that they get where they need to be at the end and produce the healthy puppies. So at the end of pregnancy, we do encourage puppy count x-rays if you're planning to free whelp, just so that you know how many puppies to expect. We can offer C-sections, so we have an incubator and are well-versed in neonatal care. For our planned C-sections, those we can do for breeds that may be predisposed to needing a C-section or having issues along those lines. Those are ones that we use. Again, progesterone timing will give us the due date that we can go from there. Other reproductive services that we offer are medical management of pyometras or prostatitis or BPH, other things that there are other options than spaying and neutering for our valuable breeding animals, and we're happy to talk with you more if that's something that is applicable to your case. Either way, we're excited to be offering these services and helping our responsible breeders, because at the end of the day, breeding for health and promoting improvement of breeds is what will keep the breeds going and what will continue to meet the demand for dogs in the United States and produce healthy puppies for healthy homes. If you have more questions about reproductive services or want to discuss breeding your animal, please give us a call at the Animal Hospital of Statesville, and we'd be happy to talk with you more.